Now, coming to the 1 hour bundle, this is something very important and related to emergency department because the patient will be there in the emergency department for 1 hour at least. So, what we have to do is check the lactate levels, whether it is elevated or not, whether it is more than 2, that is a benchmark for septic shock. Obtain the relevant cultures. I will say relevant because you have to collect the blood cultures, the urine culture. If there is any indwelling line, like a central line or a central venous catheter, collect the cultures from that on the peripheral line both. If there is any wound, you can collect the wound swab culture. If there is in sputum production, you can collect the sputum for culture sensitivity. So collect the relevant culture. Administer broad spectrum antibiotics. The guidelines says as early as possible and at least within 60 minutes or within 1 hour from the patient contacting the doctor. Begin rapid administration of fluids or controlled fluid resuscitation for the patient. If the patient is hypotensive, start with 30 ml per kg, and then you can use the tools which we have discussed to check the fluid responsiveness of the patient. Add vasopressors whenever if the hypotension is not corrected with fluid resuscitation alone, and try to maintain a MAP of more than or equal to 65 millimeters mercury. So this is the sepsis 1 hour bundle. 5 things which we have to do. I'll repeat again. Measure the lactates, obtain the cultures, give broad spectrum antibiotics, start the fluid therapy and vasopressors if needed to maintain a MAP of more than 65. So septic 1 hour bundle, ensure lactate levels and remeasure if the initial lactate was more than 2 to check whether there is appropriate lactate clearance or not. Obtain blood cultures prior to the administration of the broad spectrum antibiotics. Begin rapid fluid administration, that is 30 ml per kg of crystalloids. Vasopressors if there is hypotension and lactate is more than 4. Initial fluid that should be given in the first 3 hours is 30 ml per kg of crystalloids, preferably balanced crystalloids. Apply vasopressors to maintain a MAP of more than 65. Additional fluid should be guided by the frequent reassessment, and it should be the dynamic assessment which changes rapidly. So we have to reassess and apply accordingly. Source control. So we recommend that a specific diagnosis of infection requiring emergent source control can be identified or excluded rapidly to obtain the culture. As we have discussed, if there is a wound, we know that the sepsis is occurring because of that soft tissue infection or the wound. We have to collect the cultures from that wound. If there is a lung infection or pneumonia, sputum can be collected. So appropriate cultures from the source of sepsis have to be collected. Antibiotics, broad spectrum antibiotics, as soon as the cultures have been collected, should be started, and it should be given within 1 hour for both sepsis and septic shock. It should be as per the antibiotic stewardship program.